I'm Julie DeSimone. I'm the program officer of the Mayor's Wellness Campaign here at the New Jersey Healthcare Quality Institute. So before we get started, just a few housekeeping items. All the phone lines will be muted for the duration of the program to limit background noise. The webinar is going to be recorded and posted on the website after the presentation, so you can check that out afterwards. And you can ask questions by typing into the chat box, and we're going to answer all the questions at the end of the presentation. We likely will not take up the whole hour with the slides, so please feel free to type those questions in. Okay, and so in today's presentation, we're going to do a brief overview of the Quality Institute and our community health initiatives. And by the end of the presentation, we're going to cover the definition of social isolation and how it's affecting your residents, a step-by-step instruction on how to create volunteer-based program in your community to fight social isolation among older adults, tips for successfully recruiting and training volunteers for your program, and then finally, how to utilize this new toolkit in your local programming. Okay, and so I want to just provide a quick overview of the Quality Institute to give you a sense of who we are. The Quality Institute is a multi-stakeholder nonprofit organization, and we believe that collaboration is essential to improving our healthcare system. So we convene healthcare leaders in New Jersey around the common goal of improving the safety, quality, and affordability of healthcare for everyone. Our work falls into four main buckets: quality improvement, policy, education, and community health. At the Quality Institute, we have two main community health initiatives. The first is our Mayor's Wellness Campaign, which is where we're going to spend most of our time today. The second that I want to talk about is the conversation of your life, also known as COIL. COIL aims to change the culture in New Jersey around advanced care planning. And I want to give you a quick overview because while advanced care planning is important for people of any age, it is especially vital for older adults, which is who we're really going to be talking about today. And COIL provides evidence-based tools and strategies for residents, caregivers, and healthcare providers to discuss and document wishes about the treatment that they want to receive in case of a medical emergency or serious illness that might leave them unable to speak for themselves. COIL has developed a community conversation around the kind of care that New Jersey residents want to receive and how residents can plan ahead for medical emergencies or a serious illness. COIL provides educational community events throughout the year, and we've been able to offer virtual programs throughout the pandemic to continue these important conversations. Incorporating a COIL programming into your Mayor's Wellness Campaign is a really great way to bring these much needed conversations to your community. So if you're interested in offering this program, I can connect you with our community coordinator to get started. So our Mayor's Wellness Campaign, as I think many of you will know, is our statewide community health initiative, and this is in partnership with the New Jersey State League of Municipalities. We provide evidence-based tools and guidance to mayors and community leaders to help their residents achieve a more active, healthier lifestyle and to improve the health and wellness of their communities. And with the Mayor's Wellness Campaign, mayors have the platform and tools they need to make their community a healthier place to live, work, and play. We currently have 419 participating communities, and we're adding more each year. So if your community is not part of the Mayor's Wellness Campaign, getting started is really easy. The first step is for the mayor to sign our annual pledge of participation. We ask mayors to sign the pledge each year to show their ongoing commitment to health and wellness in their communities. Last year, we launched a Mayor's Wellness Campaign handbook, which is a really great resource for towns that are looking to get their program started or to enhance your current program. The handbook provides tips for creating a local Mayor's Wellness Campaign, which is really the second step for your program. And the committee should be made up of a diverse group of stakeholders from your community. The handbook also walks you through how to do a local needs assessment, and it lists resources to assist with that process. You'll find a press toolkit with sample documents for you to modify for your town and guidance on how to plan, implement, and evaluate programs in your community. In addition to the handbook, we offer 30 evidence-based tools for towns to use to implement programs in their communities. The tools cover topics such as physical activity, nutrition, sustainability, and the arts. And we're always expanding our toolkit to reflect the needs of our communities. Okay, so that's a quick overview of our community health initiatives and a little bit of background about how we're going to talk a little bit about how the Mayor's Wellness Campaign decided to take on social isolation. So in response to the pandemic last spring, we were able to hold focus groups in all 21 counties across the state. And we asked community leaders to share their experience in dealing with the pandemic on the local level and to identify top concerns going forward to manage the pandemic. And the top areas of concern were food insecurity, mental health of residents, and social isolation of older adults. And we've seen communities use this year and their program to really address a lot of these issues, especially food insecurity throughout the state. And so in response to those other growing needs, the Mayor's Wellness Campaign sought funding to create a toolkit to address social isolation, and we were able to partner with the Mayor Group to complete this project. The project is being launched in Passaic County, and so you'll notice that a lot of the resources and examples are specific to Passaic County, but we are happy to help to customize this program to work in your community. So I just want to start about talking about what social isolation is. While the two are related and both are important, I just want to point out the difference between social isolation and loneliness. Loneliness is subjective, and it's an emotion resulting in the discrepancy between actual and desired levels of social connection. So that feeling that you get when you're hoping to be more connected to your community, but that those connections don't exist. Social isolation, on the other hand, is objective, and it refers to the lack of social contact with friends, family, neighbors, and the community in a broader sense. There are a lot of risk factors that contribute to social isolation. Some of these I think are expected and others are not going to be quite as obvious. Living alone and not having family living close by is definitely a risk factor. Having poor relationships with family or those in the community. Long-term illnesses, including physical or mental illnesses or disabilities that can make it more challenging to go out or have people over, and transportation issues are all going to contribute to social isolation. Unemployment is also a risk factor since it reduces the chance that you're going out and engaging in the community. And finally, exposure to domestic or community violence. So if somebody's experiencing domestic violence, their interactions may be limited or controlled. And if someone doesn't feel safe going into their own community, they're less likely to go out. And so these risk factors to me really highlight the importance of social determinants of health and the impact that they have on individual health. And it's a good reminder that we should be thinking about health in those broader terms in our community. I also just want to mention that AARP has a risk assessment that individuals can use to gauge their level of risk of social isolation. The assessment can be found in the toolkit and also on the AARP website. So I think that we can all agree that social isolation is not something that we would want our residents to experience, but you may not realize how seriously it can impact other health outcomes. So individuals experiencing loneliness or social isolation report exercising less, using substances, including alcohol and cigarettes more, and report poor sleep. Studies have focused on this issue over the last 10 years and have found that being socially isolated increases risks for serious health issues such as heart disease, dementia, and premature death from all causes. The health impacts of social isolation are often compared to smoking 15 cigarettes a day. And it's also it unsurprisingly puts individuals at risk of increased rates of depression, anxiety, and suicide. And so, there's been a lot of conversation around this in the last year, especially because of the pandemic. So again, many of these might not be surprising. But aside from the hardship and suffering that this creates for individuals and families, it also results in significant healthcare spending. So talking a little bit about the prevalence of social isolation, even prior to the pandemic, studies have shown that more than 1/3 of adults over the age of 45 report feeling lonely, and 1/4 of adults over the age of 65 and older are considered to be socially isolated. As we know, the pandemic has drastically impacted these numbers regardless of age group. And preliminary studies are suggesting that just 1 month of social distancing and stay-at-home orders increased loneliness by as much as 30% and emotional distress tripled. So this is really something that is relevant to all of our communities right now. And vulnerable populations, including older adults, people of color, and low-income individuals have been disproportionately affected by all of the effects of the pandemic. Okay, so I've painted a pretty dim picture, but now we're going to talk about our new program, which we're really excited to share with you today, that's designed to reduce social isolation at the local level. So as I mentioned before, the Mayor's Wellness Campaign has over 30 tools that provide step-by-step guidance to offer for communities to develop and implement and evaluate programs at the local level. And so I'm going to walk you through our newest tool, which will help you to create a volunteer-based program to help you match older adults in your community with volunteers to help to reduce social isolation. Okay, so the toolkit starts out by providing an overview of social isolation and some of the definitions that we just discussed. It also explains the benefits of connectedness, and I just want to point out that those benefits for the older adult, but it also includes benefits for the individuals volunteering in the programs. Studies have shown that volunteering can reduce the risk of depression, create a sense of purpose, and helps individuals stay mentally and physically active. And all of these are important supports needed, especially at this time. So the first step to creating your program is to engage a member of your Mayor's Wellness campaign as your program lead. This isn't something that we always recommend for all of our programs, but specifically for this program, there's a lot of moving parts, and it's important to have a point person who's going to be responsible for managing that. It can be a volunteer or a municipal employee. So just keep in mind the demographics of your community. If you think it's likely that program participants may speak languages other than English, be prepared to address that not only in the staff or the volunteers that you recruit, but also in your marketing materials and resources. So after you recruit a program lead, then you're going to want to recruit your program volunteers. I just want to point out that throughout the toolkit, when we refer to volunteers, we mean the people who will be matched with the older adult who's experiencing social isolation, and we'll refer to those older adults as program participants. So the volunteers will be matched with the program participants who are experiencing the social isolation. And so there are lots of different options for places to recruit volunteers from. And there's really no wrong answer, but some examples would be houses of worship. Each county throughout New Jersey has a county RSVP program. So it's a program specifically for retired seniors who are looking to volunteer their time. You can reach out to them and they might be able to connect you with individuals who are looking to volunteer. Local high schools and colleges. I really like that option because I think it's nice to include the intergenerational option. Local nonprofits and Mayor's Wellness campaign staff. I can also help you to connect with a local volunteer nurse through our partnership with the New Jersey Action Coalition. You can also list your volunteer opportunity on Volunteer Match, which is a website that connects people looking to volunteer with local opportunities. So people can search by their location and then be able to sort through depending on what type of activity they're looking for. And finally, you want to advertise the need for volunteers in your local social media platforms, newspapers, and in libraries. Treat recruitment like an advertisement, provide information about the program as well as the benefits for volunteering, and really make the case for why somebody would benefit from being part of your program. Next, you're going to want to screen your volunteers. So currently, programming is likely to be virtual, but you still want to ensure the safety of both your volunteer and your program participant. And an interview is one way to get a sense if people will be a good fit for the program. It doesn't have to be anything too intense, but just getting a sense for the person and what their goals are in the program and who they might be a great fit with for the program. And while it's potentially expensive and time consuming, if possible, it's also great to consider fingerprinting and background checks, especially if the programs are going to be done in person. I also just want to point out that if you'd like more information about volunteer management, we do have a recent webinar recording up on our website that talks all about volunteer recruitment, volunteer management, and how to make the most out of your volunteer program. So you can find that on our website as well if you're looking for more information about this. Okay, so after you recruit your volunteers, we're going to talk a little bit about recruiting program participants. This is where the connections to your community-based organizations are going to be really helpful. As a city or municipality, especially if you're not providing direct services, you may not be aware of specific individuals experiencing social isolation, but the organizations in your community that work with residents on a regular basis will. You can provide the organizations with information about your program and how to refer an individual. You can consider your local or county senior centers, local or county senior services, food banks, libraries, and local healthcare providers. These are all great options for places that people might be touching base with those community organizations. And because this program is really based on the idea that people might not be connected with their community, you also want to make sure to give older adults who are not receiving any services the opportunity to sign up for the program themselves. And so advertising in local papers, at the grocery store, or places of worship are a great start. Okay, so the third step is going to be preparing your volunteers and your program participants. Training volunteers is really important. It can be brief and it can be done virtually or even over the phone, but at a minimum, you really want to make sure that it includes an overview of why reducing social isolation is important, parameters for conducting meetings safely, specifically during the pandemic, and including guidelines for social distancing, mask wearing, and the use of technology, a basic cultural competency overview. This is important to help volunteers understand how diversity can impact interactions, especially if you have volunteers who maybe haven't worked with people before. You also want to include a summary of expectations so that volunteers can know what their experience will be like. I really review this in the volunteer management webinar, so it's a great resource if you're looking for more information, but it's really important to set clear expectations for your volunteers. It makes it much more likely that they're going to have a positive experience and then also stick with your program. And finally, you're going to want to provide volunteers with 2 of the resources that are part of this toolkit, which we're going to go over in more depth later. We have a conversation starter and a resource list. Okay, so it's also important to provide a brief orientation for the program participant. They might have been referred to the program and be unaware of why. And so again, it's better to be transparent up front while also being respectful and let the person know why you feel they can benefit from the program. This could be admittedly tricky given the topic. It might be hard for people to hear that they've been identified as being socially isolated, but you're going to have more success being upfront in the beginning and having them buy into the program. You should also be sure that they're clear on the goals of the program to help them, that the goal of the program is to help them get connected to their community. It's important to lay out some of those boundaries so that the person doesn't think that their match is going to help them with errands or transportation, financial assistance, or anything else that isn't agreed upon ahead of time. And this can really reduce awkward situations or conflict that may arise if you don't provide that information up front. Again, this orientation can be done virtually or over the phone. With some of the older adults, you may want to be prepared to have to give some tutorials about using platforms such as Zoom, if that's something that your volunteers and your matches are interested in doing. And there's also a lot of communities that have used their library system to provide this kind of training. So those are options as well. And again, by setting clear expectations for both the volunteers and the program participants, you have a better chance for success in the program. Okay, so now we're going to talk a little bit about matching volunteers to program participants. This is not a perfect science, but we do recommend providing a brief survey to both volunteers and program participants prior to their entry into the program. You can ask for basic information such as languages spoken, preferences for communication options, whether it be in person, if that's safe at the time, phone calls, or virtual platforms like Zoom. Given the population, not everyone is going to be comfortable with Zoom or maybe even phone calls, so it's just good to have that information ahead of time. You can also ask for availability. Basic information about preferences for time of day and days of the week up front can prevent potential scheduling issues. And you can certainly add other questions to the survey, but I think depending on your pool of volunteers, it could overcomplicate your match process. And I think sometimes it's just part of the growing pains of the program is just putting people together and assessing later how it goes. And we're going to talk a little bit more about program evaluation later. And so then the next step is really to host an introductory session. This should be conducted by the program lead. It helps to have the volunteer and the program participant get the opportunity to meet prior to setting up their first individual meeting. You can be sure that they exchange contact information so there's no confusion about getting in touch with each other later. and also encourage them to set up a regularly scheduled meeting time for their interactions. Having that third party there can, first of all, it's a nice safety measure just to make sure that everyone is aware of the program and who they should be meeting with. And it also just, again, sets the stage for what the expectations of the program will be. Okay, so we're going to talk about evaluating the impact of your program. It's really such an important step of all of our Mayor's Wellness Campaign programs. It allows you to determine the effectiveness of your intervention and make any changes that you might need to along the way. It's important to really put these evaluation methods in place prior to starting up your program. You don't want to start trying to evaluate your program once you're already, in the thick of it. And so the program lead should schedule a check-in call with program participants and volunteers 1 month into the program. If a match doesn't seem to be a great fit, you can offer the participant the opportunity to be matched with another volunteer and just be mindful of doing that in a sensitive way. In addition to those check-in calls, pre and post surveys can also be used to get more detailed information of the impact of the program and to determine if you're meeting your program goals. Surveys should be provided at the start of the program and then in timed increments throughout the program, such as 30, 60, and 90 days. The surveys can ask participants to assess their feelings of loneliness, their need for support services, and also their satisfaction with the program and their volunteer. You can also survey the volunteer to assess their satisfaction as well. Again, it's not a perfect science, and you should expect to want to modify your program along the way to make sure that you're doing what makes sense for your community. In that Mayor's Wellness Campaign handbook, we have sample surveys that you can utilize to develop these tools, or you can also reach out to Quality Institute staff for help in developing one. So I mentioned that program evaluation is important because we want to make sure that we're really having a meaningful impact on our community issues. Another benefit to being able to demonstrate program effectiveness is that it serves as a marketing tool. If you're able to show that 95% of your volunteers say that they had a positive experience with your program, you can really use that data to draw in more volunteers and more program participants. Similarly, if you can say that in 90 days, 85% of participants were able to increase their social interactions, and you might be able to encourage other people to join your program who are experiencing social isolation tools. So it's really just another tool helping you to build your case for why your program is so important. And being able to point to objective data can also support your requests for more resources and funding for your programs. And finally, and arguably most important, the feedback allows you to make those changes along the way, as I mentioned. Some programs aren't perfect, and we know that when working with residents, a one-size-fits-all approach won't always work. And so feedback from your participants and your volunteers can identify room for improvement throughout the process so that you can be sure that you're delivering a quality program to your community. And as with all of our Mayor's Wellness Campaign programs, the toolkit is really just meant to serve as a guide. You know your community best, and some pieces may work really well and others might not need to be tweaked to fit for your community and your residents. And we, really encourage you to think about that and use that flexibility. So also included in the toolkit are links to other resources that you might find helpful while creating your program. There's research and background information into why social isolation is such an important topic, more information about the benefits of volunteering that might help you in marketing your program to potential volunteers, and then examples of other programs from across the country addressing this issue. So you can be sure to check those out but prior to developing your program. Okay, so now that we've walked through the toolkit and program development, I want to move on to the two resources that are included in the toolkit that I mentioned earlier. The first is our volunteer conversation starter guide. Sharing memories and telling stories is a great way for older adults to develop relationships and stay connected. And it can be challenging to start these relationships with someone that you've just met and that you've been matched with randomly, especially during the pandemic, if you're not having these conversations in person and you may be having them over the phone or through a virtual platform. And so this conversation starter guide is meant to assist volunteers with ways to engage their program participant in some conversations to break the ice. It's also important to remind program participants that everyone has a unique history and life experience. Questions that may seem basic, to us may evoke a negative or emotional response for some people. So if a question seems to make one of the program participants uncomfortable, volunteers should be able to be prepared to just move on. And some of the topics that are covered in the guide include childhood, so suggesting questions about where the person grew up or their favorite activities, people and events that matter, with questions about important moments or family traditions, questions about favorites like hobbies and vacations, and then finally questions about the present, giving program participants the opportunity to talk about important things in their life. So this tool should be included as part of the volunteer training, and it really just gives volunteers a place to start if they're feeling lost or need help. It's certainly not an exhaustive list of topics that we expect the volunteers to cover. Another tool created to support the work of the volunteers is the resource list. So while the intention of this program is not to have volunteers providing case management or formal referral services, it is possible that program participants may share that they have some other basic needs throughout this process. And so for that reason, it's really important that the volunteer is prepared to respond to those requests. You can always have the volunteer just refer these issues back to the Mayor's Wellness Campaign program lead if they're not comfortable, or if you're not comfortable having them manage some of these requests. But it's also helpful to have a general list of community supports available that the volunteer can provide to the program participant as needed. And as I mentioned earlier, this program is being piloted in Passaic County. So our resource list has 3 services available to Passaic County residents. Towns can create something similar for their local community or at the county level, and I'm happy to assist with that as well if needed. So you can provide the contact information and a brief description of the services available. For example, in Somerset County, we featured Eva's Village, which is an agency that provides basic needs services, including food and shelter, as well as mental health and substance use services. The county Meals on Wheels and senior services information is also included. So again, not an exhaustive list. There are plenty of other services available to residents, but it gives volunteers and also the program participants a starting point if they're in need of other services. Again, let volunteers know that this is meant as a resource for them to pass on to the program participant, and they're not required to call the agencies themselves unless both they and the program participant are comfortable with that. By being able to connect program participants to other needed services and resources, you're really expanding the impact beyond reducing the impact of your program beyond just reducing social isolation and helping people to get connected to the services that they may need in their community. So I wanted to share an example of how a similar program worked within the past year. And at the height of the pandemic, the Health Coalition of Passaic County and one of our Mayor's Wellness Campaign, Healthy Towns, the city of Patterson, recognized the necessity to address social isolation of older adults in the community. And so with funding from the Henry and Marilyn Todd Foundation, they recruited high school students to conduct wellness checks on older adults over a period of 10 weeks, while also addressing any identified social needs that the adults were experiencing. And so this was a short-term project that gave older adults the opportunity to connect with a younger generation, to reduce their social isolation, and gave the high school students the chance to learn about the older members of their community. So it was a really great example of how leveraging community partnerships can result in meaningful programs for their residents. And the feedback from this program really helped us to identify some helpful tips and tools for our own toolkit. Okay, so that was our overview of our new tool, and I can take any questions if we have them. So if you have any questions, you can just type them into the chat box or into the question and answers. Okay. So our first question here is, what are some of the ways that towns can keep volunteers and program participants safe during the pandemic? So this is a good question. We recognize that part of the need for this program is really because of our increased, or I should say our decreased ability to meet with people. I think that as we move into the the warmer months, we know that outdoor meetings are safer. We still encourage everybody to be social distancing and wearing masks. And we also recognize the value of those phone check-ins, even though, won't replace those in-person interactions, are really going to be helpful just to have somebody to connect with on a regular basis. Most people have learned to navigate the virtual world at this point. And again, offer to train your volunteers or your program participants in using platforms such as Zoom if needed. So continuing to just encourage that contact while continuing to follow safety precautions. Okay, great question. So how did Patterson identify their residents? So the Health Coalition of Passaic County is an organization that works directly with older adults and residents. And so that was their role in the program, was to identify those who might be in need of this program. So again, using those community partners. I think the healthcare system is a great place to look for these referrals, because they are interacting with everyone. People are continuing to go to the doctors, and even more so now, we know that people are getting back to their regular and preventative care. And so they might be able to, through their screening process, identify people who are looking for these services. I also think any nonprofit in your community that works with older adults or the general population, they know your residents best, and they're going to know who's in need of services and who might benefit from a program like this. I also think, like I said, it is important to allow folks to self-identify as needing this program. And I think it's, how you market the program is going to be relevant here, because you want to do it in a way that people feel comfortable and safe saying, I identify with this. I'm feeling socially isolated and I could benefit from having somebody to connect with. So putting those flyers up at your grocery store, or in your newspaper, or places that older adults in your community, or frankly, any age person in your community who might be experiencing this is a great way to advertise the program and have people sign up voluntarily. Are there any recommendations for increasing liability insurance coverage related to volunteers? We don't have any specific recommendations about that at this time, but it's certainly something, especially when you're working within the confines of your municipality or a city government, that's worth looking into. Let's see. Okay, so in your experience, what is the time commitment required by a coordinator for this program? That's a really good question. So we haven't, this is a new program, so we haven't run this program yet, but I think it really depends on a few things. It's going to depend on the size of your population. It's going to depend on the size of the program that you're willing to run. So I think, in the beginning, you can always start small. You can decide that you only want to open the program up to 5 volunteers and 5 program participants, and then see if you have the capacity to move forward. I think a lot of the time commitment is going to be on the front end. So getting these, all of these processes in place, whether it's the volunteer and program participant recruitment is obviously going to be a heavier lift, making sure that evaluation piece is set up prior to the program getting started, and then doing those interactions in the beginning where you're asking, where you're present for those volunteer and program participant meetings. That's going to be a significant time commitment, but once those relationships are in place, I think it will be reduced. So it's I can't say specifically a time commitment, but I do think it's going to be heavier on the front end. And again, as with any volunteer or even any staff person, you want to be really upfront with that in the beginning, so that whoever is getting involved knows what the expectations are and can prepare for that. Okay. Have volunteers worked with seniors in housing authorities? And if so, could we arrange a Zoom meeting with the community stakeholders in Union County? So again, this is a brand new program, but I do think that the housing authority, especially people who are in senior housing, this would be such an excellent partnership for municipalities to reach out to. And we'd be happy to help facilitate a meeting like that to present this program to community stakeholders in Union County, or make the case to the seniors in your housing projects that they're able to participate in this program. Volunteers chosen ready before you. Okay, so do you usually get volunteers ready before getting the participants? That's a really great question. I do think it makes sense to develop a pool of volunteers prior to looking for program participants. That way, once somebody on the program participant side is ready to engage in the process, you have volunteers that are ready to go. There is something to be said where if somebody decides that they're ready to ask for help, you want to be able to respond immediately. Sometimes people will either get cold feet or they'll decide that it's no longer something that they want to engage in if there's too much lag time in between. So you also don't want to collect too many volunteers and not have program participants for them to be matched with. So I think it's a balance. Getting a few volunteers ready to go prior to recruiting program participants certainly makes sense. And then you can develop your marketing strategies for both participants and for volunteers as you see what the interest in your program is. So fingerprinting and background checks for volunteers. There are services throughout the state that do this. A lot of professionals are required to do this through licenses, and many municipalities do this for their employees as well. So it's something that you would want to go through your chain of command in your community, but there are private companies that do this throughout the state, and we could certainly refer you to them if that's something that you're interested in. Would you recommend getting participants in nursing homes? So I think that that's a tricky question specifically right now. Obviously there's not a lot of traffic in and out of nursing homes right now, but I think it's something that if the nursing home was willing to help you to facilitate the program over the phone or in that virtual platform, nursing homes would be a great place to look for program participants for this. We know how isolated individuals who've been in nursing homes were during this and continue to be throughout the pandemic. And they are certainly people who would be in need of this program, and that would be a great partnership. Okay, so just a reminder that the presentation is being recorded and it'll be up on our website. This is my contact information and our website. All of the resources that I mentioned, we'll be sending out a link directly to the toolkit after this presentation today. You can also view it on our website. The recording for this webinar will be up on the website. And additionally, that volunteer management webinar that we have recorded is also on our website. If you have more questions specifically about the volunteer management piece, I would really recommend that you take a look at that. It has a lot of great tips and tools for you. How can you help a participant who does not have technology? That's a really good question. So first, I just want to point out that it doesn't have to be done through Zoom. There are programs throughout the state at the county level that run similar kind of wellness check programs that are just done through phone. So not that every person in New Jersey has access to a cell phone or even a landline, but the majority of people are going to have access to a telephone. So that's always an option that you can recommend. But there's also been a lot of programs that have come out throughout the year and a lot of nonprofits who are working on getting people who didn't previously have access to technology, access to tablets or Chromebooks or things of that nature. So those are things that you can look for programs and help to connect people. You can ask at the county level if there are any programs in your community, or you can reach out to me and I can try to help you identify some opportunities for that. It's something that we've definitely seen an increased need for, but also a response from different funders being able to provide people with that technology to help them stay connected. Okay, again, so also the handbook is on our website, and that's going to have all of those different tools that we talked about. It explains that we want mayors to sign the annual pledge of participation. It gives you tips on how to get your program started, creating a diverse Mayor's Wellness Campaign committee, and doing that local needs assessment, and then working on setting some goals for your program and explaining how to walk through some of the steps of implementing these programs at the local level. So all of these resources can be found on our website, which actually, as I'm saying that, I realize that it's not on this slide. So our website is just www.njhcqi.org. And I will be sending out the toolkit as a follow-up to the webinar, and I'll also make sure to include links to some of these other resources that we've talked about. Thanks, Dapa had put that in the chat for everybody. with the website. All right, let me see if we have any other questions before we wrap up. Okay, so I think that we covered all of the questions. Please feel free to reach out to me if you want any assistance in setting up your program, not only just the social isolation toolkit program, but any of the other resources that we talked about today, or getting connected with different volunteer opportunities in your community. And we really are excited about this toolkit and think that it's going to fill an important need in the community. And we hope that you guys found it useful. And again, reach out anytime if you need assistance creating this program in your community. All right, thanks for joining us.